Hello, my name is Dr. Hillel Mazansky and I specialize in nutrition, exercise, guided imagery, and medical hypnosis. My website being drdrmedicalhypnosis.com for your personal health care hypnosis videos. Today I'm going to discuss getting control of your cholesterol. Everyone these days seems to be talking about cholesterol, and rightly so. Cholesterol is a fat which is necessary for the body, but high cholesterol can lead to conditions such as heart attack, stroke, and PAD or peripheral arterial disease. There are two types of cholesterol, mainly the good cholesterol or HDL, which stands for high density lipoprotein, or LDL, which is known as low density lipoprotein, which is the bad protein. The normal values for the cholesterol should be 200 milligrams percent or lower, and the LDL or the bad cholesterol should be lower than 100 milligrams per deciliter. There are no symptoms from cholesterol, and the diagnosis is made either when the blood test is taken routinely or when the patients present with one of the complications of high cholesterol, such as heart attack and stroke. When should one begin getting tested for cholesterol? The age is 20 years of age. We should start checking the cholesterol, especially in those cases where there's a syndrome known as familial hypercholesterolemia, where high cholesterol comes in families, and the cholesterol can be extremely high, over 300 to 400. Especially those people should be checked, but everyone should start getting checked at age 20. What raises our cholesterol? It is saturated fat. The saturated fat that one finds in fatty red meat, cheese products, and other animal products, including palm oil and coconut oil. Coconut oil is not good for you as it has high amounts of LDL or low density lipoprotein or low density cholesterol. If one does in fact have high cholesterol, immediately you go to your doctor and they give you statins. These statins are special drugs that are used to lower the cholesterol. They lower the total cholesterol, they increase the HDL or good cholesterol, and they move the cholesterol from the blood. Men at age 50 usually start having high cholesterol. Females, on the other hand, begin having high cholesterol when they go through menopause. Now, cholesterol is very necessary for our bodies. Every cell needs cholesterol, and it is used for hormones, making hormones and making vitamin D, etc. But when it gets too high, that's when the complication sets in. The most important fact to lower one's cholesterol is to exercise. Cardiovascular exercise, increasing slowly until you are perspiring, that is one of the best treatments to lower your cholesterol. Then, of course, there is a diet. Have a low saturated fat diet. Do not eat red meat, cheese, or eggs, which are also very high in cholesterol. You can eat the whites of the eggs or the protein portion, which is healthy, but not the yolk of the egg. It's all a matter of going dieting first and lowering your cholesterol. If after you've had extensive exercise and you've kept to a nutritious diet, of very low cholesterol and your level is still high, then and only then do I suggest you should take statins. Because as mentioned before, high cholesterol, over 200 milligrams of the LDL, should come down to 100 milligrams of LDL. The HDL should be around 60 milligrams per deciliter. 60 or higher protects one against stroke, heart attack, and peripheral arterial disease. So it's important to get your cholesterol done, not only your total cholesterol, but also your HDL and LDL, high-density lipoproteins, and low-density lipoproteins. It is the latter which does the damage, while the former HDL is protective. It goes without saying that trans fat is absolutely taboo, and one should not eat trans fat at all, as this is very dangerous for health. The main complications of high cholesterol, I say again, is heart attack, stroke, peripheral vascular disease, and it can even affect the kidneys, that you have kidney failure, can affect the eyes, etc. So it is very important to keep your cholesterol low, and in that way you will live a longer, healthier, happier life. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.